These are the boxes of food that the dogs get to eat. Inside are little packages of wet dog food. Okay. They split one of these for Sophie's ready to eat. They split one of these in the morning for breakfast around 8 o'clock or whenever. One of them around 1 o'clock or lunchtime, and they split one for dinner time. So breakfast, lunch, and dinner, you take one of these, take off the cap. This peels off the top. And then I usually just scoop half in the bowl for Sparky and half in the bowl for Sophie. And just kind of mush it up. Okay. And then on top of that, you take a little bit of the dry food. Just take a little bit and sprinkle it over the top, like you're making an ice cream sundae. Okay, that helps fill them up a little bit. And then I take some water. I usually get it nice and warm. So it's nice and warm for their little tummies. Use warm water. I don't measure anything. I just put in like a squirt. Like
it's a very big squirt.
One there. Yeah, it's a big squirt. And then I do with the other one. The water. And then I mix it up really good so we have like beef stew or whatever, chicken or fish or whatever's the concoction of the day. So mix it up really good. And they each get one of these. Now Sophie is also on an antibiotic right now in this blue bottle. She has a urine infection because of the diabetes. She does not like this. So here is one little capsule like this. And what I do is you just stick it right in there, and right in her food, and mix it in there. She thinks it's a piece of rice or something, and she just usually eats it. If she spits it out or doesn't eat it and it's left in the bowl, just throw it away. Try again next meal. Actually, she only gets this at breakfast and dinner, 2 times a day. And it's almost gone. So, I don't know. Whenever it's done, it's done. Okay, so this was the pill bowl, so I gotta make sure Sophie gets that. And then they each get their beef stew. And they'll eat and drink that up. With the diabetes, Sophie has been going to the bathroom a lot because that's what happens in diabetics. So let her out at least every 2 hours, just so she doesn't have an accident in your house. She's been pretty good at, she can even go 3 to 4 hours. It gets worse as the day goes on because the blood sugar builds up in your stream. By the end of the day, you really have to watch her and make sure she's going out and going to the bathroom. And you'll notice her water bowl will be empty all the time. Diabetics also drink a lot of water until her blood sugar is regulated. So she might be throwing that water bowl around if it's empty. You just have to keep refilling it and then let her go potty. So, okay, and that's what they eat for breakfast, lunch, and dinner. Okay, this is how we give Sophie's insulin. It has to be given after she eats, like preferably 20 to 30 minutes after she eats, so her blood sugar doesn't get too low without eating. So she has to eat to get the sugar in her system, and then she can have her insulin. It's always kept in the fridge. We have it in the butter compartment, but it has to be kept in the fridge. And this is her insulin bottle. And you can see the clear and the cloudy. It's really separated there. So we got to mix that up. And we do that just by rolling it between your hands. You don't want to shake it or do anything. This is just gently mixing it together so you don't wreck the elements and get air bubbles in your medicine. And just by doing that, it should get pretty mixed up. So now it's all cloudy, and that's what you want to get. This is her box of syringes that she needs. There's a whole bunch in here. I usually take one out in the morning, and then you can save it and use it for both morning and evening dose. She gets one dose after breakfast and one dose after dinner. There's a cap on the end. You gotta take that off. And this cap where the needle is. Very teeny tiny needle. She doesn't even feel it. She doesn't even know you're doing it. Alright, and then she gets 4 units of insulin. And you can see on here, that's a very small dose. Here's the 5 right here. Next, you know, so it's not much at all. And so we're going to pull up enough air. You can just go to the 5 for the air. You have to put whatever you're taking out of this vial, you have to put that amount of air in to equalize the pressure. So I'm just going to do 5. And this is a little rubber thing on the top here. So it's just like rubber. And you're just going to stick the needle into the rubber and push that air in. And then you just tip it upside down and withdraw the insulin. I'm just going to go a little past the 5. We only want 4, so I'm just going to push the rest in. If you go past 4, if it's not exactly 4, it's okay. This is such a small dose, it's not going to hurt her. So, and if you go a little past, there's usually a little air bubble in there anyway. And then you just pull it out. And you can put that back in the fridge until your next dose. So when you give her insulin, you just grab the skin behind her neck. Right here. And then if you feel there's like a little flap of skin down here.
Like a tent.
It's like a little tent. And all you do is you stick it right just in her skin. Pop! And you just push it in. And then take it out. And then it's done. When you put it in her skin, it really doesn't matter where you grab on top of her back. You just want to get a handful of skin. The reason this needle is so small is you just want it to go into that top layer of her skin. We don't need to get into the muscle or anything like that. We just want to get into the skin layer. So you just grab that skin and just poke it in that top layer of her skin. It doesn't really matter where, just anywhere on top here. Okay? If she's distracted and hard to get to hold still, you can give her a little treat on the floor, and while she's eating the treat, she doesn't even know what you're doing. Okay? It's a good girl. Yeah. And then you can just put the cap back on, save it for the evening dose, and if you've already given the evening dose, then just toss it in the garbage. And that's it.